Hi, everyone, and welcome back to the Mind Movement Health Podcast. I'm your host, Kate Boyle, and today we have a special guest on the show. Lydia, welcome to the podcast.
Thanks for having me. It's a pleasure.
Well, I'm excited to have you on because today we're going to be talking about being our own sort of self advocate for our healthcare and our family's healthcare and creating, healthy routines so that hopefully we don't have to go down that avenue for ourselves too much. But before we dive in, can you please introduce yourself to our listeners?
Sure. So I've been a pharmacist for 30 plus years, and in the space, I have encountered many, many times as a pharmacist, parents who come in and just want more help in navigating the healthcare system and also with medications. Number one therapy is medications, it's drug therapy. So there's a lot of rules and tricks to the trade. So throughout that journey, and as I embarked on going onto social media and having questions asked and showing different things that you should be aware of safety wise, I've come to understand that questions. We want to be able to advocate, to communicate clearly our concerns, what we should know. So, what is the education pieces? And that's kind of what I help parents understand and really get to the heart of how can they help their children in those high crisis, high stressful situations with some like calm confidence and walking into them with, you know what, I've got this. I know what to do.
Well, that's amazing because I think I've been very lucky. I haven't had to navigate any of those situations with my children myself, but I have had to navigate those situations with my parents. And
Mhm.
it was a bit of a minefield, to be honest. Like, you don't have any training, to deal with
Mhm.
healthcare systems and how to talk to people and information that they want. And it can be really confusing and overwhelming.
Absolutely. And I think that you've just exactly expressed sort of what I see and feel, right? As pharmacists, we're sometimes the frontline person. And so we'll hear, well, my doctor said, or I'm not sure what to do with this. And when I worked in the healthcare system, when I did nursing homes and assisted living facilities, a lot of, you know, children of parents, older parents, just weren't even sure, like, is this the right avenue? Is this actually ALS? Is this Lou Gehrig's disease or is this Lyme's disease that's progressed? How do I find out? What should I ask? I think the critical, most important things, I kind of say that your look both ways is the ACE method. And I realized that if you do those three things in all your situations, no matter which healthcare environment, if you A for advocate, C for communicate, and the communicate piece being you have your questions written down, you know your signs and symptoms, you clearly and concisely put those together, you track your symptoms, and then the E for educate piece where you go back, you take the information, you kind of figure out what's happening, you digest it, you look online, you look at different resources, you get second opinions, you ask family and friends, you go to associations, you build your community around that. Then usually you look both ways before you cross the road. Those are your three pillars in that. And that's the critical piece. And even in dealing with, when you're in that situation, well, what legalities so that I can be the primary caregiver, so that they can speak to me about the file? How do I navigate things with my family? Well, how do you navigate things with your brother or your sister for your parents? How do you navigate these things with your spouse or our partner? How do you make sure that if I'm not home, he knows my child has this allergy or she knows, that's kind of why it's so important to do those three things. Know what to ask, what to track, and how to speak up and what to follow up on. Those are your key critical things. Doesn't matter, dentist, veterinarian, if you follow kind of those three main things and become an active participant, your chances of errors when entering the healthcare system become less, and your confidence in the sense of like, I don't feel so overwhelmed because I've kind of segregated this and I have a plan. You'll feel a lot better in that plan and you'll get the answers that you need to make proper decisions.
Well, I think that's fantastic advice because so many of the things that you went through there, it seems like common sense. Like to me, it seems like common sense stuff. But when you're in the moment and it's happening, you kind of can't focus on anything else because you're trying to understand what they're saying. And so those sorts of things, you know what I mean? You don't have space in your mind to think about, like you said, the questions because you're just trying to digest what that person's telling you at the time. So I think having, like you said, those questions prepared and then going off and doing some of your own research is great. And what I found too within the system is my mum couldn't be her own advocate. She just wasn't in the position to do that. So we needed to step up to be that person. And having an advocate for someone made a huge difference in the treatment that she received. Maybe it shouldn't, you know, it really shouldn't have, but having someone that was following up and asking questions and, you know, booking appointments and all these things made her treatment, you know, happen more quickly and flow more smoothly than if we hadn't have stepped in.
Oh, absolutely. You 100% want an advocate. You know, if you have to go to Merge by yourself, I often say then you want to bring your information with you, but you want to call someone and be that extra eyes and ears because there is absolutely no question that advocating or having an advocate with you reduces your risk of potential harm. It's not even like maybe, it's 100% because the healthcare system is very overwhelmed and it's across the world. You know, it is a situation where there's shortages of staff, there's the resources as far as the amount of money that's put into systems and how systems are developed. That causes errors. And, you know, we think, oh, well, we're in an age of AI and everything should be just 100% accurate. It's not. A lot of the systems are still manual. They're still, you know, human based. So in other words, we don't have robots that dispense medications. It's still a pharmacist that's checking these things. It's still a human being. So there's still human error. No matter how brilliant the healthcare professional is, there's human error. And so by checking and saying, oh no, my mom is supposed to be on 3 medications, or my child was supposed to be prescribed, you know, this medication at this dose. Well, checking that, it's not something where you are questioning a healthcare professional. I never see it as questioning. I see it as, thank God somebody said something and checked so I didn't make a mistake, right? I mean, something as simple as I remember I was doing a flu clinic and it was one after another after another. We were booked like every 5, 10 minutes and we had to, you know, get these flu shots done. And when you're in that as a healthcare professional, you're going quickly. And so when somebody said, oh, I have a latex allergy, I didn't see it on the sheet. So I'm about to put a band-aid, and the person's like, oh, I have a really severe reaction to latex. Does the band-aid have latex? And of course, I had to stop and think, oh my goodness, I don't know. Does it, doesn't it? Oh my Lord, I didn't even catch that this person had this allergy. So by advocating, that wasn't anything that was wrong. It's the 100% correct thing to do. So as you said, things went smoother, things went better. She got the care that you felt was better and for her, more tailored to her. That's because now the healthcare professional has more information rather than less. And this is the best way for me to describe it. If you are renovating your kitchen, you are going to meet with the design planner. You're going to come up with a plan based on your likes, your needs. In healthcare, you're going to meet with a group of healthcare professionals based on the disease state, based on the symptoms. Certain things are going to happen, right? We're going to do this test. Well, in the kitchen, we're going to order these cabinets. When it comes together and someone's coming in to install and it's wrong, you're not going to say, oh, yeah, I ordered a black cupboard, but I got white. It's okay. Go ahead. No, you're going to say and speak up, right? You're going to say, but that's not what we planned. And so if a nurse is coming in to give a medication, you should be asking, oh, what medication are you giving my mom? Are you giving my child? What's the dose? And if the nurse says, oh, I'm providing clindamycin, but the doctor told you that it was supposed to be amoxicillin, you need to speak up. So that's the same thing. I think in healthcare, you know, even myself, if I have to deal with my child and I'm in health and I'm in an emergency department, you become panicked. You know, you're not thinking clearly, but you have to take a couple deep breaths, take a step back and think of your ACE and just go through it methodically, step by step. Doctor said this is the plan. This is not, and then we watch. You have to watch. So is the child doing better? Is the child doing worse? Now with this medication, are there side effects? So you watch it. And so when you're in that situation, you just have to remember you have a voice. That advocacy piece is your right in healthcare. It's not I know that a lot of people sometimes feel like, well, I don't want to question. That needs to be removed now. You can't even think about I'm questioning them. The way that you communicate is, I just want to follow up. I just want to understand. I would just like to know. You're just genuinely trying to make sure that whatever is happening is going to be safe and is following the plan. And if the plan has to change, you also have to speak up.
Mm. Well, I love that too, because as you said, I think there is sometimes that barrier that when there is somebody in that authority position, maybe the way you've been brought up or a different generation, you've been taught not to, question that. And so I know a lot in those types of situations when there is a doctor, there does seem to be like a hierarchy, and a lot of people are afraid to question anything, or like you said, they may not know how to phrase it correctly. So it's more about gaining the understanding rather than feeling like you're, questioning what they're doing as such.
Yeah, I always say the best way, and I have been on the receiving end of things, right? The best way to discuss things is just say, I just want to clarify. You just start with that. I just want to clarify. I just want to understand based on what you said before. I just want to clarify. I just want to understand. And if you're feeling unseen or unheard, and again, because it's a high-paced, very fast, quick, quick, quick. Maybe I didn't read everything in the chart. So you want to point out, I have an allergy. Does that medication have any, issues with it? How many times at the pharmacy when we ask someone, what are your allergies? And they say, I have a penicillin allergy. We look at the prescription and go, this has penicillin, right? So by you saying, oh, I just want to make sure, I just want to clarify with that prescription, does it have any problems with my allergy of penicillin? You've protected yourself. So that's what I feel is, I just want to clarify. I just want to find out. I just want to understand. Can I just like, just so I know that I understand, can I rephrase what you've said and take that time? Because you are entitled to care, and you are entitled to the proper care for yourself and your children and your family. And so that extra 2 minutes is going to save a lot of hardship in the long run.
Mm. And if somebody's sort of listening in and they're like, this is great advice, but I'm the type of person that can't think of what questions to ask because maybe they're not familiar with, the condition someone has. It might be, they've only just first heard of it when their loved one's being diagnosed with it. Where should they sort of start to think about where to find what questions to ask or know which questions are the right ones to ask?
Right. So I always say you ask the 5 W's. It's just as simple as that. So, right from the get-go, why this treatment plan? What does it entail? What's the risk versus benefit? How will it affect me? When, what's the timeline? When will this occur? And then how? How is this going to transpire? And then what you also want to know is just like, what do I do for follow-up? When do I come back to hospital? So if you're in an emergency department and they say, well, this looks like it's viral, so your child should get better in a few days. Okay, if it doesn't, if the child doesn't get better and it doesn't follow that plan, when do I come back and where do I seek the help? So you're always asking, and that's really the pivotal thing. Just think of it like a kitchen reno. If somebody is coming and doing all of these things, you want to know when are you doing this? Why are you doing it? How are you doing it? What do I need to know? And, how is this going to affect me and my family? And so, if my child is taking this medication, what are some of the side effects? So you just have to think of it that way. The other way that I think when you're asking questions of the doctor is they're going to give you a plethora of information, right? We see this, we see this, we see this. And then just ask, say, number one question, what is the risk versus the benefit of this treatment plan that you've proposed? Because if you think of nothing else to ask that question. Is that test necessary? Is that operation, necessary? Is that the most um, effective way to deal with this? Are there other options? So if you ask risk versus benefit, that communication piece will come out through that discussion because the physician's going to explain to you why they feel this is going to be the best treatment and what the risks are. And every person has a different profile of risk versus benefit, right? So if it's for me, my risk of taking a medication for epilepsy and having a side effect would be very high because I don't have seizures versus somebody else who does have seizures. No, no, that medication and those side effects is smaller risk compared to having a seizure. So risk versus benefit, if you remember anything else, that's your number one question.
That's a great one to ask. And can you apply that across the board when it comes to like treatment, as in like surgery, or it might be a medication, or it might be a vaccine or something like that?
Absolutely. Everything. A veterinarian, like what's the risk versus benefit of using dry food versus, wet food for my cat, be it based on their weight. Every every healthcare encounter for anyone, risk versus benefit is the number one question that you should ask so you understand how you want to take that direction, right? So, do I want to be on this medication if it's going to cause these side effects? Do I want to do this surgery if it's going to potentially have these high risks? Or is it a situation where, you're in a car accident, you're having a heart attack? We are going to give you these medications to save your life. There is no risk in it, only benefit because you're ready. If we don't do it, you may pass, right? So every level of healthcare also has this risk versus benefit. So if you think of a pregnant woman who's now asking whether or not they should have the vaccine for RSV, just going to throw that out there because vaccination is really a hot topic. And where you want to find out about this is not necessarily on social media, but look at what is the risk versus benefit and look at credible resources. So, for your particular situation, if you have a young child and you're going to have, a child that's going to daycare and coming in and back and forth and in and out, and you have a newborn, so your risk is going to be higher than if you're just isolated, you and your husband, and he works from home and you're at home and there's no one coming to your home. So, it's risk versus benefit for your particular situation. And you want to ask those questions. Same thing as if you're traveling. If you're going to a country that has a high risk of measles, do you then go with, your children to that high risk area without getting vaccinated? Or if you're at home and you're not going to be traveling and you're not going to necessarily encounter those viruses, what's the risk versus benefit? That's how
Mm.
you have to look at things.
And when it comes to finding credible sources, as you said, a lot of people tend to lean into social media or they tend to ask family members or people they know because that's their network. But if someone is
Mhm.
trying to find credible sources, should we be looking up, scientific journals or looking at a specific association to kind of get stats and things like that?
Absolutely. I think I one of my favorites is PubMed. That's where a lot of physicians and healthcare professionals we go and look things up. When it comes to medications, prescriber information right from the drug company is available to us. And again, you have to take the information and you have to customize it to your situation and to your health profile and to your children's health profile. Because when you read it, when they make medications come out on the market, every side effect is listed. Even if one person in a million had it, it's listed. So it may or may not be for your particular situation because you might not have the diabetic disease state as well as the heart disease, right? So there is information that's available. But the key thing is to read it. Like look at the Mayo Clinic, that's also a really good resource. Read the information, compile it, make some questions, and then go back to the physician, pediatrician, gerontologist, whoever it is, neurologist. You go back with your questions and say, I would like some of these questions answered based on what you explained to me. I need to clarify. I've read some of these things, or I've been informed of some of these things, or, I've had family members or friends that have gone through this and they advise this. Can you tell me how this would impact me in my healthcare journey? And so you're not going to be the same, right? That's why we say don't share medications because Someone else might be able to be okay to take that sleeping pill, but you with your medications, you're not going to be okay, right? So it's the same thing. We can take the advice, but that doesn't mean that in your situation that's going to work 100%. So the key thing is, yeah, you can Google, you can chat GPT, but do not follow only that advice. Take it back to a healthcare professional and based on your tests, your lab results, your x-rays, your health condition, bring that information into it. And sometimes it's really helpful, even as a pharmacist, when somebody comes and says, you know what, I was reading that I should probably check my vitamin B12 because of this, this, and this. This is my disease. And I'm like, that's a great idea. Let's write you an order to check your vitamin B12. So then we do, and it comes back and it's low, or it comes back and it's normal. Like there's things that we can action on by having that information that you've researched and doses. I'm going to tell you that when you have a child or even an older adult, those two categories, the medication doses are different. And so you want to make sure that if someone says, I'm going to start your child on amoxicillin, that you do a quick Google search to see what's the dose range for amoxicillin based on weight. Oh, 20 to 40, 20 to 90. What is it? And then you can calculate it and say, oh, okay, that works. Because even for my own daughter, when I was in the hospital, the dose was wrong, but I was a pharmacist and I knew how to calculate it. We're fortunate. Now we have our phones. We can look it up. I couldn't look it up 20 years ago. I had to use my knowledge. So use these resources because they're available. When a tablet is given to you, have a look at it. Does it look like that? There's images of medications. If it doesn't look like it, ask, say, like, this is what it's supposed to look like. It says it's white. How come it's pink? And they can say, oh, well, that's a different formulation or whatever it is. Or they could say, oh, you're right. It should be white. We got the wrong one. It asking and being involved again is your number one defense.
Mm. And I think it's a good point too to sort of think about that if someone does say the doctor says a client of mine was told that she needed to go on statins. So she started taking statins, but like you said, the risk benefit ratio, she started to have very extreme side effects to the point that she couldn't get up. She was in so much pain, it was interrupting her life. So she went back to the doctor and she said, this is what's happening. What other options are there for me? Because I think sometimes people, if the doctor gives a option, they sort of go, well, that's the only option I have. But there usually is other options. It's just maybe not the doctor's preferred option or the easiest option or something to begin with.
Exactly. I mean, we start, like I said in the beginning, drug therapy is the number one therapy in treating our signs and symptoms and disease states. But there is a wealth of knowledge that, we have as far as protocols are concerned. So we might start with this medication to see how you tolerate it. But then if that doesn't work, there's like, there's all these little charts and algorithms that go, okay, well, let's try this then, or let's try that and follow up and going back and tracking your signs and symptoms before versus after and seeing how you're doing. It's really important. You don't want to adjust medications just on your own. You want to be able to have that collaborative journey with your healthcare professional to say, you know what, I tried this isn't working for me, I'm not comfortable with this, and be honest. Just be honest. I haven't taken it, because that honesty and transparency will help you versus the doctor saying, oh, well, I'm going to add another drug because your blood pressure isn't come down. But you haven't been taking your first blood pressure medication properly. So then you think, okay, well, I don't want to take that one because it gives me, a stomach ache. So I'm going to try this new one. But the new one shouldn't be taken without the other one, right? So then you're creating even more confusion for yourself and for your body. So it's really important to be also very transparent and honest with how you're using your medications, how you're doing the treatment. If you go to physio and they say, do these 10 exercises, he says to you, how was the exercises? And you say, great. He says, okay, I'm going to add more, but you never did them in the beginning. You're not helping yourself, right? So, we're shy and we're embarrassed to say, no, I didn't do it, but that's the truth. And that's actually more beneficial to you than not telling the truth.
That's it. And that's what I see with my clients. Being a Pilates instructor in a studio, but really focusing on a lot of rehab work, clients will ask for homework and I will give them homework and then they will come back and they will say, "Oh, I didn't do the homework." And I'm like, "That's okay." So then, I may have given them three things to focus on. So then I'll be like, "Okay, this next week, you're only going to focus on one thing." So we change it to make it more manageable for the person, or pick, one exercise that's really going to, change and cause bigger changes more quickly and try that. Because, like you said, if the doctor doesn't know, they can't adjust it either to, something that may suit you a little bit better.
That's exactly correct. It's really important to, to be transparent and clear, concise, and honest. Even things like, do you drink alcohol with this? No, I don't. But then you do. You have a beer. Well, just be honest with it because it might change or alter the way the medication's being absorbed. It might change or alter your blood sugars. So it's really important to, paint the correct picture so that everyone can see how your healthcare journey is going. And then that way the healthcare professional is on it, they're on your team. They're not leading it. They're just trying to be a part of the solution. They're not the solution. You are the solution. You're the one with all the information. You're the one that knows your body best.
Mm. And I think sometimes too, it just slips people's minds. Like they forget that they had that beer the other night with dinner. But that's where if you are tracking your symptoms or, whatever it may be, you're tracking the food you eat and the medications that you take, then you can always refer back to that if you've written it down, somewhere to then just review to see, oh, yes, I did have that. And then that may make more sense when you get certain results.
Exactly. And you know how, you go to the lab and they say, were you fasting? What time did you stop eating? And then you're like, yeah, I fasted. But then, when did you stop eating? Oh, I think I stopped eating at 9. But then you forget that you had a glass of juice at 11:30, and then that throws everything off, right? So it's really important to track. It is because tracking is the history of what is happening. And when you go to a doctor's office, I think it's really important to bring that information as a parent. If you see or notice something in a child and you're not sure, like if there's a twitch or there's something, you're not sure if that normal behavior or not, just take a video of it. If there's a rash that's there, these things are very helpful. We have these tools and technology. They're helpful to use. So then you can go into the doctor's office with, yes, these are what I am experiencing. It's a high fever. It's been a fever like this for 3 days. This is the medication I've given. This is these are the things I've done, so that it's much clearer for the healthcare professional to then intervene properly. And if you're not sure, well, what questions should I ask? Well, just create those questions before you go in. So then you can say, like, what should I do? Do I give more Tylenol? Do I give Advil? What other non-drug measures can I do to reduce fever? What do I have to do in order to, check on whether or not this medication is working? How do I know if the ADHD medication is working? Or how do I know if this is going to make an impact for pain? What do I check? What do I do? Do I have to come back in 3 months to get blood work done? Really understanding those things. And when you're a caregiver to a child or even to an older parent, it becomes overwhelming. So really keeping yourself organized and tracking things, appointments and follow-ups and bringing the information, because there's also this continuing continuity of care. So when you leave the hospital and go back to the community where you're speaking to your doctor or what happened at the hospital, sometimes that information doesn't transfer. So you're the person who has the information and you have to transfer that knowledge over. So you want to make sure that you have clear records, that you ask for transfer documents, that you ask for next steps so that you know when you're about to have surgery, what are the things I should do in the next 3 months to make sure that I'm ready for this surgery? Do I increase vitamin D? Do I have to make sure that my blood sugars are really followed well? Do I increase a medication to make sure that happens? What do I have to do with my blood pressure medication that morning? So you understand the plan, right? And when you do that, I can tell you that your stress level comes down because you don't feel like, I don't know, I don't know, I don't know, I didn't ask that, I didn't, if you have your questions written down, you've got that 15 minutes, you ask them. Don't ask the doctor when he's about to walk out. As soon as the doctor walks in and says, how are you? You go into your questions. Just look down and start reading your questions because that's the other thing. We engage in conversation sometimes and then we forget, oh man, I didn't ask this. So if you have it written down, you just go question by question and you'll be amazed at how much information you get through when you're dealing with it that way.
Mm, I love that. And I think, exactly what you said. I think our system is very good at, say, booking the surgery, but not so good at all the steps that you can do leading up to the surgery to really optimize your health and that before you go in. And then post, the operation, the things you can do
Right.
after that to really help with recovery. I think sometimes those two ends of it get lost and we're just focused on, the treatment plan in the middle.
I agreed. And you're right. The stuff that you need to know ahead and also the stuff that you need to know after. So, one of the common things is having a regular bowel movement after surgery because you have so many medications that slow down your intestines. So what is the right thing to do? There's so many people that become impacted after surgery because they didn't start on a bowel routine and they just start eating normally and then they're impacted and then they go back into hospital or they have pain and the medications is not enough to treat the pain or they have an infection happen at the wound site because we weren't watching this or we weren't dealing with this. So it's really important to have checkpoints. It's also when you do the surgery, like when do I check in, when do I come back, what makes me come back sooner, why should I come back? There's certain protocols that you want to ask. And it's unfortunate that we don't do enough of pre and post surgery care and information because you're now on the ward. If it's a day surgery, you're in, you're out, you might get some pieces of paper. You're not feeling right. You just had surgery. You're not going to start asking a bunch of questions. So having that extra pair of eyes and ears helps too to have that, but tracking things and knowing when to come back. I always say this, when you have a plan from a treatment plan or any kind of plan from any healthcare professional, you want to know if the plan doesn't go accordingly, what are your steps?
Mm,
What are you
yeah,
supposed to do next?
great
Because then
advice.
you also, right, you also know, okay, if this doesn't go well, or here are some of the things that could go unwell or not well, in those situations, you need to come back. So you have to ask those questions and who to call. Like oftentimes, well, who do I call now? My mom isn't doing well. Who am I supposed to call? It always happens on a Friday night or on the weekend. So who do I call at that time? So it's really important to know those things.
Mm. And I want to flip it now. And just because I think a lot of people, when we're talking about sort of healthcare, they're thinking of the healthcare system. We're thinking about doctors and, hospitals and surgeries and, medications. But we can think about our own healthcare prior to any of this happening. So, all the things that we can do to help our own health. Do you have any advice for people of the things that they can do to try to prevent, needing medications and surgeries and creating a healthcare system that really prevents the need for any of this?
Well, number one is in prevention is, of course, we talk about diet and exercise. Number one, okay, I understand that part. We talk about that and the importance of it, but I also talk about preventative screenings. We can't, as caregivers, especially, I feel many caregivers ignore their own health. They don't go and do their yearly physical. Right? It's like, oh, I'll put it off. I'll put it off next time. You don't go and get your teeth cleaned once a year because it's like, oh, I'll just wait, I'll go back to it. So it's really important to schedule and make a priority for yourself to do your preventative screenings and to do your yearly checkups because that's, you're talking about once a year, maybe 2 hours out of 365 days. I think it's important to schedule and to do it. And then in that way, we talk about, for women, do the breast exams, do some of the preventative things you can do at home. If it's tracking your periods, make sure that you do certain things that will prevent issues later on because you can catch things early through preventative screenings. So it's really important to do these things and to make sure that we talk about diet and exercise, that you make some of these things a priority, even if it's just 10 squats a day before bed. Anything will help versus zero. And then when you're making choices with food, I often say, like, it doesn't have to be this big thing. Try and limit dessert to just maybe if you're eating sugar every day, try and skip one day. Try and reduce it a little bit every day. You can't make these mountains of changes, but you can do little things. For me personally, I always park my car far away. That's my thing. I park it at least a 10-minute walk away from the mall, It's like I just park my car far away with the groceries. Yes, it's going to take effort for me to push that cart. That's good. That's good for my muscles and it's good for my body. So, when you imagine if you go to the grocery store once or twice a week, you're now getting 20 minutes worth of exercise that you wouldn't have done because you park really close. You know what I'm saying? So little tiny changes can help with the diet and exercise. It doesn't have to be all or nothing. And then we get defeated, like, oh, I didn't exercise 3 times a week this week. Well, next week then I feel like, oh, there's no point. I can't get it. I can't do the routine. No, just do 10 minutes, park your car at work a little bit further away. You've got 10 minutes. So those are the little steps, but scheduling preventative screenings, it's really important to marry your diet and exercise with that.
Mm. Well, I think you bring up a lot of points there because women generally, are tending to look after everybody else before themselves. I know I have a number of friends and mums that are like, oh, yes, I've, pushed that appointment, that dentist appointment back again, such and such. My son needed to go to here and there, and it's just been too busy a week, so I'll get to that. And I do feel like we tend to put a lot of those preventative things on the back burner because there's nothing wrong right now. So we just think, oh, it'll be fine. But even like you said, recently I had a skin check done, just again a proper preventative thing, and they
Mhm.
found a mole that was the type of BSB or whatever BSC, one of the ones that can possibly become cancerous. So they've addressed it now before it becomes an issue. So
Right.
often people say, preventative healthcare is expensive. They think, buying healthy food and, doing classes and, seeing the dentist and that it's expensive. But I always say to my clients, it's more expensive if you are unwell, like, or if you need to get treatment for something because you might not be able to work, there's your income gone. You can't
Right.
do all the things that you want to do. Your quality of life drops. So it's a lot more costly to treat it than to prevent it in the first place.
Right. Well, health is wealth, right? If you're healthy, you can do many things. But when you talk about even moms or caregivers as parents, one of the things that I always look at it like, well, if I don't look after my health, I can't take my children to activities. I can't be here for my kids. So it is literally, put the mask on first, right? It is so important to look after those. And you know what? This is how I do it. I know this is going to sound crazy, but on my birthday, I always book on my birthday. I don't work that day. I book it off. And on my birthday, I do doctor appointments. I take a book, I take my favorite music, and I just do my doctor's appointments. I schedule it every birthday because every morning, that's what I do. And then in the afternoon, I'll go and do my little spa thing or whatever I want to do, even if it's just walking, whatever it is. But my mornings, every morning on my birthday, that's what I do. And people are going to be like, that's crazy. I would never do that on my birthday. But I do it because if I don't do it, I won't do it. So I kind of feel like then it becomes every year that it's my tradition to do that. I'll treat myself to my coffee because usually it's free that day. And I just go and get my coffee and I drive to my appointments. And I mean, I do them all. I go to the doctor, I go to the dentist, I get those things done. If I have to go to the dermatologist, I'll just book them because it's a year in advance. So I know that day is what I'm going to do that. And nothing comes up because that's the day I'm doing it. Now, if I fall sick, that's a different situation, but that's how I do it. I book it. I know that's the day. And if it falls on a Saturday, Sunday, I do it on the Friday. And it's just done. So pick a day, whatever day that is. Once a year, that's going to be your day.
I like that idea. Even as you said, even if it's not on your birthday, just pick a different day that you can organize to put all those appointments in. And because if you are the type of person where you are, working and you've got a family or you've got aging parents, it can be really hard to find 2 hours here and an hour here but if you just block off one day and it's done in one go, it's a lot less hassle, I think.
Yeah, well, you have 364 other days to do all the other stuff. This is your day, you know? That's how
Yeah.
I look at it.
Which is almost crazy that, you know what I mean? We are leading such busy lives that we don't feel like we can find, this time. And when you say it like
Mhm.
that, it's only one day out of 365, it really feels like there shouldn't be any excuses. Like we should be able to give ourselves at least one day.
Well, I mean, this is the thing with being parents, you and caregivers, and I feel, women are the caregivers of the world. And so we do put many things and people in front of our own, health and wealth in the sense of like mental health and our well-being. And that's what I mean by our wealth is because when we are physically and mentally well, we can create, and I'm not just talking money wealth, but like our family is very, united. And it's because we're typically it's us who is the glue for it, right? When you think about a mom who's not feeling well, a lot of things sort of go by the wayside,
Mm.
right? So it's really important to understand that we're actually doing this for our family. We're helping ourselves, and in doing so, we help our family. And I think that's sometimes I had to shift my mindset too, because you get going and you get going, and then it's like, no, I have to. And I've had some, you situations where I don't feel well, and what is this? And oh yeah, I'll go next week, I'll go next week, I'll go next week. And it's like, no, you gotta go when you're not feeling well, and you've got to do those preventative screenings.
I agree 100%. Now, before we wrap up, I always like to ask my guests if there's one piece of health advice that you could give to our listeners now that after listening to this episode, they could go off and instigate straight away, what would it be?
Number one, healthcare journal. That's what they need. They need a healthcare journal. I am working on one, but the number one thing that you need is to track your questions. You need to make sure that you have something to record the information and that you also have it so that in a pinch, for anybody, they can grab the journal, whether it's an emergency situation or not. We know the allergies, we know the weight of the child, we know, different medications that the person's taking. Tracking this is an invaluable tool because that is the picture that's painted for any healthcare professional trying to treat you.
Mm. I think that's great advice. I'm going to start one now that you've just said that. I'm going to start one for my family. So then I can put my kids in, and then, when they're unwell or whatever it is, I can put it down. So then if something does happen and they need a history of some sort, you can look back and see it, not just kind of go, oh, yeah, there might have been a symptom, a few
Yeah,
weeks ago. So yeah, I
right,
think
right.
that's a great idea. Now,
I
before
have some
I was going to say,
Sorry,
do
I
you
was
have?
going to say I do have some free resources, just tracking resources, questions to ask the doctor. They're on my website. They're free resources. You can check it out, and you can actually print them and create a little binder for your family for sure.
Amazing. So, where can people reach out, find those resources, and connect with you?
So my website is momshealthcarenavigator.com, and so is my tagline for Instagram. On my Instagram, I show different disease states and what you can do, questions to ask as well. But if you're planning on putting together a healthcare binder, I have that. I have an ebook that sort of helps you with the ACE principles and guides you. And I've also created a course that I'm just working on so that you can as well learn how to navigate in detail if you're dealing with a child or a parent where you have to, obviously have more involvement in healthcare.
Amazing. Well, that sounds great. I will link that all up on the show notes too, so people can head across there to find out those contact details. But thank you so much for coming on the show. I think this is a really important conversation that a lot of women in particular, but just people in general, should be having so that they do feel more empowered when they do have to, step into the healthcare system for whatever reason.
Yeah. Well, thanks for having me. I appreciate it. I hope that it helps one person, if not many more.
Amazing.